Pneumothorax. Pneumothorax, commonly called a collapsed lung, occurs when air enters or collects in the pleural space. Air in the pleural space creates pressure against the lung, causing it to collapse partially or fully. In most instances, only one lung is affected. However, there have been rare occurrences of this lung disorder with both lungs failing at once. Collapsed lung is a rare condition that may cause chest pain and make it hard to breathe. A collapsed lung requires immediate medical care. Causes: a blunt or penetrating chest injury, certain medical procedures, or lung disease can cause a pneumothorax. Other risk factors are pregnancy, tall, thin body type, tobacco or cannabis smoke, family history of pneumothorax. Spontaneous pneumothorax is more common in men. Smoking has been shown to increase the risk for spontaneous pneumothorax. Various medical conditions that may increase the risk of developing pneumothorax include chronic obstructive pulmonary disease, cystic fibrosis, severe asthma, emphysema, tuberculosis, acute respiratory distress syndrome, thoracic endometriosis, pulmonary fibrosis, lung cancer, and sarcomas involving the lungs. Pneumothorax may also occur following an injury to the chest wall. Injuries that may cause collapsed lung are blunt trauma or injury, any penetrating injury, and fractured rib. Lifestyle factors associated with collapsed lung are drug use, especially inhaled drugs, changes in air pressure, scuba or deep sea diving, smoking. Symptoms: the symptoms of pneumothorax can vary from mild to life threatening. The onset of symptoms for a spontaneous pneumothorax normally occurs at rest. A sudden attack of chest pain is often the first symptom. Signs and symptoms include shortness of breath, chest pain on one side, especially when taking breaths, sharp pain that may lead to feelings of tightness in the chest, bluish discoloration of the skin due to decrease in blood oxygen levels, rapid heart rate and breathing, confusion, cough, fatigue, loss of function in the affected lung, hypoxemia, loss of consciousness or coma. Some cases of pneumothorax have almost no symptoms. This can only be diagnosed with an X-ray or another type of scan. Anyone experiencing the symptoms above should contact their doctor or seek immediate medical help. Types of pneumothorax. Pneumothorax is classified as spontaneous and traumatic. Spontaneous pneumothorax. Spontaneous pneumothorax doesn't occur after injury. Instead, it happens spontaneously. It's further divided into two types, primary and secondary. Primary spontaneous pneumothorax occurs without any underlying lung disease. The direct cause of PSP is unknown, but people who smoke a lot or have a family history of pneumothorax are more likely to get this disorder. Also, it affects more men than women. Secondary spontaneous pneumothorax occurs due to underlying lung problems that cause an increase in intrabronchial pressures. These include COPD, cystic fibrosis, pneumonia, and tuberculosis. Traumatic pneumothorax occurs as a result of sudden trauma or injury to the chest wall. It can be a minor or significant injury. The trauma can damage chest structures and cause air to leak into the pleural space. Tension pneumothorax. Any of these above types of pneumothorax can turn into a tension pneumothorax. It occurs when air enters the pleural space on inspiration but cannot escape on expiration. Air gets trapped and cannot be released during an exhale. This process leads to increased air pressure in the pleural space, resulting in collapse of the affected lung that's life-threatening and needs immediate treatment. Diagnosis. In non-emergency situations, doctors will first physically examine a person. They may tap on their chest to check for abnormal sounds or listen to their breathing through a stethoscope. A family history physical exam as well as a chest X-ray can confirm the diagnosis, but you may have a CT scan or ultrasound to further assess the internal organs and to acquire in-depth images of lung structure. Treatment. Most forms of pneumothorax require medical attention. If you do not have any symptoms, the pneumothorax is small. It might clear up on its own. Observation should be the treatment of choice for small pneumothorax without significant breathlessness. It will usually take 6 to 8 weeks to fully recover from a punctured lung. However, recovery time will depend on the level of injury and treatment involved. People with secondary spontaneous pneumothorax may experience more severe symptoms and face a greater risk of serious complications and death. Treatment. Treatment includes bed rest, observation, simple aspiration, closed intercostal tube drainage, and tube thoracostomy. Oxygen therapy. Some people may need oxygen if their lung capacity is deficient. In COPD patients, oxygen should be administered with proper caution who may be sensitive to higher concentration of oxygen. Simple aspiration. Simple aspiration is recommended for all primary pneumothorax requiring interventions. A needle is attached to a syringe via a catheter is inserted at the affected site in the lung to pull out excess air trapped in the region and allow the lungs to re-expand to their normal size. If simple aspiration is unsuccessful in controlling symptoms, then an intercostal tube should be inserted. Chest tube drainage. When a pneumothorax is large, a tube is used to remove excess air, which involves inserting a small tube between the ribs or under the collarbone to release the air that has built up. This will slowly decompress the lung. As the air pressure decreases, the lung re-expands and heals. You may have this tube in place for a couple of days or longer. Pleurodesis. Pleurodesis is a procedure which sticks the lung to the chest cavity. This may be used to prevent further collection of air, or if the pneumothorax is not getting better after a few days, your doctor makes an incision and inserts a tube and uses chemicals to attach the lung to the chest cavity, eliminating extra space in the chest cavity. In case of persistent air leak or failure of the lung to re-expand, then open thoracotomy and pleurectomy are done. Video assisted thoracic surgery offers significant advantages over open thoracotomy. VATS approach involves the use of 3 ports. VATS is less invasive, hence there will be reduced pain, faster recovery, and shorter hospital stay. After treatment for a collapsed lung, healthcare provider will recommend avoiding smoking, air travel, and scuba or deep sea diving. Complications. Although most collapsed lungs heal without problem, serious complications do occur. This can include pulmonary edema, emphysema, hemorrhage, damage or infection caused by the treatment, breathing difficulty or respiratory failure, arrhythmias, heart failure, and death. Possible treatment complications include major pain, subcutaneous emphysema, bleeding, infection, and pulmonary edema. Outlook. Pneumothorax can be difficult to diagnose and to treat. Outlook depends on the extent and type of pneumothorax as well as the cause and treatment required. A small pneumothorax can resolve with observation or minimal treatment. A secondary pneumothorax associated with underlying disease requires urgent and immediate interventions. Having one pneumothorax increases the risk of developing the condition again. A pneumothorax that continues to reoccur can be even more challenging to treat. Thank you.